And good evening now. We're beginning tonight's broadcast with growing concern over a spike in coronavirus cases across South Carolina. This as hospitals across the state are seeing more and more patients. And while the numbers aren't the highest we've seen during the pandemic, there's a real concern tonight that we'll be there soon. News 19's Eleanor Tabone has the details.
Our hospitals are definitely experiencing surge right now.
John Williams from the South Carolina Hospital Association says the highly contagious Delta variant is dragging the nation and the state of South Carolina back to numbers we haven't seen since February.
Delta variant is easier to spread and more severe, which is fueling the wave of hospitalizations.
COVID-19 hospitalizations continue to spike at Lexington Medical Center. On Friday, August 6th, the hospital reported there were 109 COVID patients, 84% of those unvaccinated. Today, there are 141 COVID patients in the hospital. 86% of them are unvaccinated.
Hospitals then, we had about 13,000 or so hospital rooms. Back then, they were sometimes filled 81%, 79%.
At a press conference today, Governor Henry McMaster said this surge isn't as deadly as the ones we saw in 2020.
At this point, it's clear it's not like it was last year.
Yet Lexington Medical say the hospital is now reaching capacity.
Speaking strictly as an epidemiologist to maximize the protection to students as well as teachers and staff, covering would be prudent.
With case numbers spiking, Dr. Anthony Alberg with USC's Department of Epidemiology, he's calling this the nation's third surge.
And what we're seeing now is even more cases on average per day than we ever saw last summer.
Mandating masks is not the answer.
And now it's the younger population who are most susceptible to this highly infectious strain.
Mask wearing does slow the spread.
In Columbia, Eleanor Tabone, News 19 WLTX.